of the services that we can arrange for you after your stay at the hospital are listed here. The first two are for discharge to home, which is the most common. We understand at this hospital that most people want to get home. They don't want to stay in the hospital any longer than they have to. So we're going to help you work out some things between your surgeon and some of our other companies that we work with to make sure that you get the full benefit and the best possible recovery. So some of those things are outpatient services. What that means is that you go home and you get to go out of your home into a laboratory for lab draws or to an outpatient physical therapist company or something like that. Those type of arrangements with the outpatient stuff is usually arranged by the surgeon's office. The key to that one is that you need the ride, because most people cannot drive for 2 to 6 weeks after surgery, depending on what side we did the surgery on and whether you drive a stick or an automatic. So if you drive an automatic and it's your right leg, then it's 6 weeks before you can drive again. If it's your left leg, it's only 2 weeks. Now, if you drive a stick shift, it's 6 weeks, no matter which side. So be aware of that with your planning, that guide person or your support network. If you want to leave your house and go out into the community and go to your physical therapy appointments and whatnot, you need to arrange for those rides for the first 6 weeks, typically. The other thing that we can do is set up home health services. And there's a variety of companies that we can offer to you. Mercy happens to own one of those companies, so a lot of our patients just tend to stick with Mercy. But if you have worked with somebody in the past or know somebody, a friend or somebody like that works with a different company, you can certainly make that special request to work with that person. So with home health, we can offer a nurse that goes into your home to perhaps check your incision, do a dressing change, help you with your medications, and do any possible lab work that's needed. We can also order physical therapy to come into your home and work with you right there in your home. It's very, very convenient, especially for that first couple of weeks when you can't drive. So that's something that we'll be setting up for you. One of the things that I do is I call people ahead of time before you even have the surgery, and these are the kinds of things that I talk to you about. What your preferences are for how you're taken care of after you leave us. That's important to us. Now the backup plan, or for those people that may not have friends or family to help out, is a rehab facility. And there are several in this area. The trick with rehab facilities is that it's very dependent on insurance rules. And in this day and age, which company takes which insurance and which ones don't? That's very, very interesting because it's constantly changing and the rules with insurance are constantly changing. So if that's a possibility that you may need to go to a rehab facility, and you know that ahead of time because maybe your family is off in Europe during the time that you're having surgery or something like that, call your insurance company to see what they will cover. Some insurance companies will cover it and some won't. So I can't stress that enough with equipment, with medications, with aftercare type of things like rehab or physical therapy. Call the insurance company ahead of time so that you're not blindsided by a surprise when it comes to that time. Your first post-operative visit will be about 2 to 4 weeks after the surgery, depending on what the surgery was. That's set up by your office. You just give them a call. Sometimes they let us know ahead of time, and we can write that on your discharge instructions, but typically you would call your surgeon's office to make that arrangement. You'll also hear from us in a couple of different ways. The first week after you leave, we have a few people that call and check up on you. some of our volunteers will make a call, and I also call each one of you after you leave us to make sure that your recovery is going okay. And I like to call you 2 or 3 times throughout the year also at various times, just to make sure that everything's going okay. But if you don't hear from me and you have a question or a concern, please call me. Don't be afraid to call me at any hour. I am here Monday through Friday, every day of the week, typical business hours, and I check my messages almost every hour. So I will make sure that you get that call back if you call in. About 2 to 3 months after the surgery, you will also receive a patient satisfaction survey. The patient satisfaction survey is actually very, very helpful to us. We want honest answers. What's good, what's bad about your stay with us. This is how we learn about ourselves and how we can improve our services and improve your lives. So please take the time to fill that out and return it.